Hey guys, what's up? My name is Dr. Sujan Kafle, and today I'll be discussing about the anterior cerebral artery stroke. So without a delay, let's start our video. So basically, I'll be discussing about the ACA stroke and its manifestations. As you can see, the circle of Willis, it ascends upwards through the brainstem towards the cerebral cortex, and in doing so we have an artery over here, the internal carotid artery, that gives off branches. This would be the middle cerebral artery that is traveling towards the lateral side, and this is the anterior cerebral artery that is traveling towards the medial side of the brain. All right, so now if we see this photo, we can see that the anterior cerebral artery, it is supplying this strip of the cerebral cortex that is lying at the topmost portion of the cerebral cortex, but not extending fully towards the back. Towards the back side, we have supply from the posterior cerebral artery. If we cut this brain into two halves and see from inside, so this basically we are seeing the right cerebral hemisphere from inside. So we can see here that the anterior cerebral artery is also supplying the medial side of the brain over this area. So the anterior cerebral artery would run in this fashion over here. So let me highlight this with red. It would run in this fashion on the medial side and then supply different areas that it encounters towards the medial side of the cerebral hemisphere. So this one over here that you are seeing, this portion which is raised and which is lying just lateral to the lateral or just outside the corpus callosum would be is the cingulate gyrus. All right, so now let's look at the different manifestations of the anterior cerebral artery stroke. This is the sensory homunculus, and motor homunculus would also look like this. So I've just put one photo over here. This part is supplied by the anterior cerebral artery. The fibers from the cerebral cortex from this region would descend downwards through the internal capsule to supply different parts of the body, forming the corticospinal tract. So basically the fibers to the lower limbs will be coming from the area supplied by the anterior cerebral artery, and then there will be ascending fibers as well. The sensations carried by the spinothalamic tract and the dorsal column medial lemniscal pathway would pass through the posterior limb of the internal capsule and then reach this area of the cerebral cortex. So basically the sensation is also coming from the lower limbs. So if we have a stroke of the anterior cerebral artery, would be losing the sensation and the motor supply to the lower limbs on the contralateral side. If we see the brain from inside, there are different areas that are represented on the medial side of the cerebral cortex. So there are different areas, as I said. One is the cingulate gyrus. The other area would be a medial frontal lobe. The other would be this area surrounding the central sulcus, which is called the paracentral lobule. So if we have the involvement of these different areas, we'll have the manifestations accordingly. So the anterior cerebral artery, it is running in this manner, and it is supplying all these areas. So if paracentral lobule is involved, it basically is involved in maintaining the continence of the bladder as well as the rectum, but uh, most of the times we'll have urinary incontinence, and rectal incontinence is rare. It is basically due to the involvement of the paracentral lobule. And as I said, this is the medial frontal lobe. The medial frontal lobe and the cingulate gyrus, they are responsible for the motivation, or the drive to initiate movements and to initiate speech. So if these areas will be involved, then we will have abulia or akinetic mutism. So abulia will be present if only one of the two anterior cerebral artery is involved. Unilateral ACA occlusion or involvement would lead to abulia, whereas akinetic mutism results from the bilateral involvement of the anterior cerebral arteries. It's like a spectrum. Abulia is the mild form and akinetic mutism is the more severe form. So as you can see over here, abulia means the partial loss of will or initiative. Patient is slow to respond and shows reduced motivation. For example, if you ask the patient to raise his or her hand, like he or she would not be able to do that right away. It would take some time. So that is abulia. If both the anterior cerebral arteries are involved bilaterally, then what we'll have is the akinetic mutism due to the involvement of the medial frontal lobe and the cingulate gyrus on both the sides. So that is a more severe form of abulia, where you have the loss of motivation and initiation. Patient is awake but does not move or speak voluntarily. So you ask the patient to raise his or her hand and he or she will not do that. So that is akinetic mutism. As you can see, the name speaks itself. Akinetic means not being able to move, and mutism means not being able to speak, because the patient lacks the drive. It's not something related to the motor nerve. It's not that patient has that upper motor neuron lesion or lower motor neuron lesion supplying the different areas like the limbs, but it's the lack of will. So this is necessary to understand. And apart from these areas, there is another area towards the medial side of the brain, so that is called transcortical motor area. I couldn't find a proper name for it in the internet as well, so if you guys know that, you can just put it in the comment. So this basically lies towards the medial side. Let me just erase this just to make it clear. Yeah, this one, the green one. So this is the transcortical motor area. If we are seeing from the back side, I have represented it by a dotted line. So if we have the involvement of this area, we'll have transcortical motor aphasia. Now I want to explain what this means in detail. So how is our speech produced? When we hear something, first of all, the things that we hear is comprehended in this area. This area is called the Wernicke's area, and Wernicke's area is the area number 22, the Brodmann's area number 22. Now this area communicates with the Broca's area with the help of the arcuate fasciculus. Broca's area would be areas number 44 and 45. At the same time, the Broca's area will also receive inputs from this, I would call this TCM, the transcortical motor area, and then the speech would be produced. In order to repeat the words that a patient hears, this axis should be intact. Like, you should have an intact Wernicke's area, an intact arcuate fasciculus, and an intact Broca's area. What TCM is doing is, it is just facilitating the Broca's area to produce speech. It is not like, if it is involved, it's not like the like what you see in Broca's aphasia. So because the supply to the Broca's area would be impaired, therefore fluency is impaired in some sort. It might not be as severe in Broca's aphasia, but still the fluency is impaired because Broca's region is receiving one of its supply from this green area. The comprehension would be intact because the Wernicke's area is involved in the comprehension, and the repetition is intact because this axis, the Wernicke's arcuate Broca's axis, is intact. So this is in contrast to the Broca's aphasia, where you have the involvement of the Broca's area itself, and if the Broca's area is involved, then the fluency is impaired. In Broca's aphasia, fluency is impaired, comprehension is intact, whereas repetition is lost. So this is the main difference. The repetition is lost in Broca's aphasia, whereas it's intact in transcortical motor aphasia. So what would happen if there is a stroke in the Wernicke's aphasia? Like, you can test yourself. I would be discussing about different types of aphasia in my other videos, but if you can make a guess, then the Wernicke's area is involved, so the comprehension would be lost, but Broca's area is intact, so fluency is not lost, but repetition is impaired even in Wernicke's area because we have the involvement of this axis. So this is pretty important to understand. So if we put all of the things together, so you can remember this diagram, and so we'll have the contralateral motor and sensory loss basically in the lower limbs. We have urinary incontinence, abulia akinetic mutism, and then transcortical motor aphasia. So that's it for this video, guys. I hope you like it. Subscribe for more. Have a great day. Thank you.